Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about Project ECHO in the nursing homes. And I'm joined by Alice Bonner, and we're going to be talking about AHRQ, which is the Agency for Healthcare Research and Quality, and the ECHO. So it's the AHRQ, ECHO National Nursing Home COVID-19 Action Network. So that's the full title of what we're going to be talking about. And so, and Alice has been on the show before. So maybe just do a quick reintroduction of yourself, and then we'll talk about this other amazing project that you've been working on.
Sure. Hi, everybody. Glad to be here. And my name is Alice Bonner. I am a senior advisor for aging at the Institute for Healthcare Improvement, or IHI, here in Boston, Massachusetts. I'm also adjunct faculty at Johns Hopkins University at the School of Nursing, working on the Capable program there. Like Melissa, I've been an advanced practice nurse, probably for upwards of 30 years, caring for and working with a lot of older people and communities and public health. So I've been working in policy for about the last 10 years. So back to you, Melissa.
Okay. So we actually, I heard about Project ECHO maybe 6 months to a year ago. So I don't know how, exactly how long they've been around, but it's been a lot longer than that. But it just made my radar primarily with the COVID work around nursing homes. So let's talk about maybe how this project came into being and how how IHI has partnered with Project ECHO to help nursing homes figure out the basics of infection control, how to manage COVID, and to provide the support that we've all seen that they have needed during the pandemic.
Yeah, sure. So, just in terms of the funding structure, we started to hear rumblings about COVID-19, last January, February, March. And by March, there were parts of the country that were really seeing a very large uptick in cases. And so federal agencies got involved, and Health and Human Services and Secretary Azar found money in the CARES Act. So the CARES Act had about $5 billion that was then designated for nursing homes. And about half of that went out directly to the nursing homes for personal protective equipment or PPE and other things like that. And then the rest of the money went to AHRQ, as you mentioned, and they contracted with the University of New Mexico and the ECHO Institute. And that's led by Dr. Sanjeev Arora and his team. And they do global work on a variety of health issues. And they have done some work in nursing homes. But the thing about Project ECHO that I think AHRQ was very familiar with from other work is it's not a model where a bunch of experts swoop in and say, we're going to do all these webinars and give you all this important information. Like, that's not what this model is. It's an all teach, all learn style of interacting among nursing homes that get together in a whole cohort of about 35 nursing homes. And they're paired up with a training center, which could be an academic health sciences center. It could be a hospital system, could be a university. There's a few that are QIOs. We have a few associations. And that training center gets resources to be able to find local faculty who have expertise in infection management and prevention, expertise in nursing homes. And then IHI was subcontracted because of their background in quality improvement techniques and facilitating ongoing quality improvement methods, not going to the nursing home and saying, you have to improve your quality. Not the model, right? It's being interactive. It's doing motivational interviewing. It's asking lots of questions. And it's really getting nursing homes to become accountable, to want to be accountable for making improvements in resident care and staff safety also. I'm sure people who are listening on this call today have heard about the high percentage of death rates in nursing homes and assisted living and so forth. And it isn't just being over a certain age. It's also being in a congregate setting that has that whole set of risks with people being in close quarters and, maybe an old HVAC system and things like that. So it's residents and it's also staff who are at high risk in the nursing home setting. So as part of Project ECHO, we now have the University of New Mexico with all of their expertise in this ECHO model, and they are paired up with folks at IHI, and we identified a bunch of quality improvement coaches around the country. And we have about 100 training centers around the country, and each of them works with a group of 3 cohorts of nursing homes. And the idea is that there's this 16-week curriculum, 16 sessions. Each session is about an hour, plus an additional half an hour at the end that people can stay on the line and get one-to-one kind of office hours support. So it allows nursing homes to get kind of a standard approach to the COVID-19 infections that they're seeing in their nursing home. There's a case study that's brought by a nursing home, and everybody talks about the case. There's some didactic information. We're doing a lot right now on vaccines. And then there's, time for quality improvement and other Q&A. And as I said, at the end, people can stay on for an additional, 30 minutes. So it's designed to be a supportive, interactive program. And I want to say this very clearly. Nursing homes are the experts in this work. If you've never worked in a nursing home, it's a very unique environment. We don't do things the same way as we do them in hospitals. And you and I have probably worked in both of those environments, and it's not the same as home care. So I think the way that we're continuing to design the system is each week we get feedback from the people doing this work. And then our team, the IHI ECHO team, is on a couple of calls every week. And we talk about the feedback and we say, people didn't like this particular video, or people thought the videos were a little bit too long and they want to be able to have shorter videos. And so then we go back and we say, okay, well, we want to make some revisions here, and this is what we want to do. We brought together speakers from all over the country. So it wasn't the kind of thing where all of the speakers are from a particular place. They really are recognized experts and leaders from around the country. And a lot of them are from nursing homes, or they are people who do presentations and consulting with nursing homes. And then there's some people who are, hospital-based or outpatient-based as well. So it's the 16 weeks. After the 16 weeks, we're still not exactly sure how the next phase would be structured, but we're imagining something like ongoing, weekly opportunities to connect with a training center, for example, some opportunities for office hours and things like that, because we know that as much as we've put in a lot of time over the last 6 months, and it's been a very intensive startup and a very rapid startup because of the high numbers of cases, in order to build this into a sustainable program, like this is the way we do our work, this is our infrastructure, we need to continue to work through some additional months to really establish this and have nursing homes say, this is the best thing we've ever seen, or this is a great addition to the way I approach my work. This helps me with my practice. This gives me more time, things like that. So it's designed for that. And again, I think the other thing I'll just end with is, while the program is right now designed, focused on COVID-19 and infection prevention and how to support staff, because everybody knows, staff is really stretched and strained right now. The same principles with Project ECHO can be applied to lots of other clinical scenarios, and lots of other quality scenarios. How do we reduce falls? How do we reduce pressure ulcers? How do we improve behavioral and mental health services, which are lacking in many parts of the country? So, the principles of how this works, and moving away from just sort of like throwing information out there, like we know that doesn't work. So we don't want to keep doing it. We want to do something different. Anyway, We started with a goal of getting as many nursing homes as possible into the program. In addition to 100 training centers, we have 7,200 nursing homes. We have half the nursing homes in the country, just about, that signed up. This was voluntary. This was not, required. And we're hoping to get that number up a little bit higher yet in the next month or so. So, getting half the nursing homes in the country interested in this and signing up and coming on the phone every week with a couple of their staff members, we see that as a big, step forward. We require 2 staff members at a minimum, and a lot of places bring more staff to the calls. And, they have to attend something like 13 out of the 16 sessions to be able to get, a certificate at the end of the program. And they do get some compensation. So the nursing homes get compensated for some of the time, and the training centers also get some compensation. So that's where the CARES Act money was dedicated to that. So that's, in a nutshell, a very brief overview.
So I will clarify, I've only ever worked in nursing homes. I've never worked in a hospital setting. So, but I know that it's a very different environment. And I will tell you that, as a new nurse, I was 23 years old, had my nursing license 3 months. My director of nursing got fired. Guess who became the director of nursing? Because I was the only nurse that had a baccalaureate degree. Did that for 4 months and was like, okay, I think this is too much for me. Be running a 125 bed facility when, there's still a lot that I don't know how to do. And so then became the care plan coordinator. So I tell people I kind of started at the top and worked my way back down.
That's okay. There's a role for everybody.
Right. But I think that the one thing is that I always felt like we were very isolated, and we were kind of the redheaded stepchild of the healthcare system, because, if in the beginning we did not have a geriatrician that would come through, we did have a medical director, but he, some of the things that he did, I didn't think were very high quality. And then we had this geriatrician come to town who used nurse practitioners, and I would call her and she would know exactly who I was talking about. She would start telling me what medications the person was on. And I was like, oh my God, who are you? Like, this is who I want to be working for. So I went back and became a nurse practitioner. And then, the nursing homes had nurse practitioners in their buildings every day that they could to provide support and, the education and, teaching them kind of what was going on in a very different way. And I think that what Project ECHO does, I actually did some interviews through this program called ICOR, it's Innovation Core with National Science Foundation. And I did 20 interviews and called people up, because my research is around training people to use the different hand feeding techniques. And I asked them kind of, how do you decide what training to focus on? And they said, well, we figure out what our problem is, and then we try to design an educational program for it. So it's a very resource lacking environment, because what they're doing is, the leadership in these facilities are just pulling something that they've been taught before and then just trying to teach it, to their staff. And it's, come in, sit down, listen to my lecture, and then, go back to the floor. And behavior doesn't change when you do it that way. So I think that it's the leadership and the preparation to be a leader in skilled facilities that I think that the Project ECHO, by making it more interactive, can help build the leadership skills and build that infrastructure again. Because I'll tell you, the people working in long-term care aren't there for the money. I mean, they're there because they care for their residents and they love their work. But to do all of that without any resources or any support,
right,
very difficult. And then it really makes me mad to see what the media does with them, kind of perpetuating this belief. So,
right.
So I'm appreciative.
Yeah, the quality coaching piece really gets at what you're talking about, which is leadership. And it's trying to inspire and motivate people who work in long-term care to really take charge and be the champions and be the leaders. And so, a lot of them never received any training. You talked about how you became a director of nursing. That's classic, absolutely classic.
Yeah, and I was the only baccalaureate prepared nurse in the building. Right. So I think people they think, oh, I'm in a nursing home, so there are nurses there. Well, there are different types of nurses. You have your nursing assistants, your LPNs, licensed practical nurses, and then you have 2 different levels of even
Mhm.
are registered nurses, some with associate
Right.
degrees, some with baccalaureate degrees. And because of the payment and reimbursement and all that stuff, it's very rare that you would find a baccalaureate prepared nurse, which is why the administrator hired me in the first place.
Right, right. But back to the quality improvement coaching piece, I think, and to your point just now about, being a nurse leader in this environment, we need ways to help people learn those skills. And it's not content like, here's how you prevent this kind of infection. Like, people don't need that content anymore. What they need is the skill set of how to talk with LPNs and CNAs, or how to talk with families, or how to think about the questions to ask, and how to actually improve systems of care and workflow and things like that. So that's a lot of what Project ECHO does, and why I think it has a particular enhancement over some of the things that you've talked about so well, that you and I have both done in the past.
So my first job in the nursing home was as a quality control infection control quality improvement nurse. And I asked them what I was supposed to do. And they said, well, you keep track of like infection, urinary tract infections, pressure ulcers, that type of stuff. And I actually literally made a paper document, like a legal sheet with every rows, had the columns for each of the different things. And I would have to do chart audits. I mean, this is before electronic medical records.
Right.
That was my job. But then I would produce this report, but I'm not really sure whatever happened. There wasn't an action plan. I mean, I think they can collect the information. It's just the skill set of then what do we do? And how do we do this in a proactive way?
Right. That's still an issue in a lot of nursing homes in this country today. And that's what we found out through COVID-19 is, the infection preventionist, either the job's open and it's been vacant for a while, or the person has 3 other jobs, or they never received any training, or they don't know how to act on what they find. So I think you've brought up a really important point. And I think, if we want to talk for a minute about vaccines, that's the other area where infection preventionists are so important, and they're in such short supply. We wanted to get people who could be speakers and presenters on some of the webinars that we've been doing as part of Project ECHO. And it's really hard to find infection preventionists who know nursing homes. You can find a lot of them who work in hospitals, but the vaccine distribution, I'm sure people have been reading in the media and all of the articles in the lay press, but they are rolling out right now in a lot of states, almost all the states, either with CVS or Walgreens as the pharmacy partnerships. So again, that was done through the federal government. They partnered with those 2 organizations. Those organizations are responsible for everything soup to nuts. So they will, contact the nursing home, or the nursing home can reach out to them. They come on 3 different dates. So they come and give a first dose, and then they give a second dose, and then they pick up a few more on the 3rd date. But they come 3 different dates, and they will try to vaccinate any staff and residents who are interested. So far, in the rollout over the last couple of weeks, the resident uptake has been very strong, upwards of 70% of residents, some cases even closer to 90% have wanted the vaccine. Staff numbers a little bit lower than that, but we're doing a lot of work on vaccine hesitancy. Why are people, not wanting to get the vaccine? What are their concerns, et cetera? The other thing is that there has been information about side effects or adverse reactions. So far, they have been very few. There have been very few people who were unable to go to work the next day. Again, there are some people who need a day or something like that to be at home, but very few. And the adverse effects usually just last for a day or 2. It's, like when you get a flu shot or something like that. So, and there are differences, having a cough, losing sense of taste and smell, having a runny nose, like those things are not side effects of the vaccine. So not typically. So we can do some teaching, and there's a lot of good information online. And I think I had shared with you, Melissa, there's, a couple of really good websites, certainly the CDC website, very important. And they have a whole vaccination toolkit now. So you can just go to that link and get your updated information. And then organizations like Leading Age and AHCA and AMDA and others have information on their websites as well. So American Medical Directors Association, also called the Society for Post-Acute and Long-Term Care Medicine now, all of those organizations have vaccine-specific information online that they update regularly. And they're all in contact with CVS, Walgreens, local departments of public health, and CMS and CDC. So I would just encourage your listeners, anybody who's listening to this podcast, when you really are ready to be out in the world at the point of care, in nursing homes, assisted living, hospitals, any setting, always, always, always check with your local Department of Public Health or Board of Health about the specific vaccine situation in your area, because it does vary state to state. Governors make different decisions. Some states are not using CVS or Walgreens at all. I think there's 2 states that are doing it on their own. So that's an option for people. And the vaccine is not required or mandated, at least not at this point in time. So it's still voluntary. And, there's consent forms, and you can get consent verbally. There's lots of information on consent, but the forms are kind of long, but we have gotten the updated information that verbal consent can be okay, unless your individual site is making a requirement for written consent. But something does need to be signed, certainly, before the vaccine is administered. And again, CVS and Walgreens doing all the paperwork. Nobody's getting billed for this. So an individual person, a resident, not going to get billed. A staff member not going to get billed. Your insurance company may get billed by these organizations, but they take care of all of that. So all of these, pieces of information, I know it's a lot to keep track of, and I thank all of you who are doing this actual work, because it is a lot of work. But CVS and Walgreens are supposed to be keeping track of all of it. They're doing all the reporting that's required. So hopefully all of that is going to continue to work smoothly.
So the vaccine education is now part of the COVID-19 infection control, or is it like an addendum? Because we talked about the COVID.
Great question. Yep, great question. So what happened was, when we started doing the curriculum development for the program, we didn't have the vaccine approval. We didn't have the EUA, right, the emergency use authorization. So once that came through, then we were faced with either, well, do we develop our own materials, or do we link to existing materials? And we did a little bit of both. So we had a webinar, Project ECHO had a webinar with some national experts specific to the vaccine. There's been a lot of other webinars that are available. So we didn't want to just duplicate what's already available. So again, Leading Age, AHCA, AMDA, all of those sites, if you go to them, you can generally find a webinar, or you can find information on the vaccines. We did support all of the training centers. So those 100 training centers, some of them asked us if they could develop their own session on the vaccine and vaccine distribution. And we said, absolutely, that's what the nursing homes are asking for. We want to support what they need. So a lot of the training centers have developed their own sessions on the vaccine, and they've also integrated into the sessions that are already developed, maybe 5 or 10 minutes just on the vaccine. And, people can chat in during the session. So it's done through a Zoom or similar platform, an Echo platform, but people can chat in their questions. And that's another way that we can keep track of the information that people want and need. One of the big questions has been, when after the vaccine can a staff person come back to work if they had certain sets of symptoms? So again, there's information and FAQs on that. And, ultimately it is up to the individual institution to say, how they want to have their protocols in terms of when staff can return. But for most staff, if they just have arm soreness or a low-grade fever or, a headache, those are typical side effects of the vaccine. Fever's tricky because that could be something else, right? So we have to make sure we take that seriously. But, a little headache, feeling tired, sore arm, if people want to come into work, they generally are able to come back with those things. Other symptoms, other signs, again, following your protocols for your center.
So if someone was interested in joining, the COVID-19 Action Network and engaging with this project, what would be the best way for them to get more information?
So we're going to provide a link, and it's the Project Echo University of New Mexico site, and it says right on the site, urgent call for partners in nursing home health. And so that's where people can just sign up. You can go to that site and you can learn more information about what's involved, and then you can sign up if you're still interested. So we encourage people to go learn about ECHO and see if you're interested.
Okay. Well, thank you so much for being with me today and sharing information about Project ECHO and the COVID-19 Action Network.
That's great. Thank you so much for having me. And thanks to all the listeners who are doing really hard work out there. Our hearts are with you. We know that it is really hard every single day, and we appreciate that you're doing it. And we know that families and residents and communities really appreciate all the hard work and dedication. So feel free to reach out to me. I'm always happy to answer questions. You can reach me at abonner@ihi.org. And again, Melissa, thanks for doing these. This is great work by you as well.
I was just going to say, I echo those sentiments.
Very good.
All right. Thanks so much.
Thank you for joining me today for This Is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.